times do you poo in a week? Once, twice, or not at all in a week? Could this be a sign of constipation? Don't worry, let's go into it. You will know. Hi, welcome back to my channel. In my previous video, I talked about the effect of alcohol on the gastrointestinal tract and oral cavity, and today I will be speaking about constipation. Constipation is broadly defined as having fewer than 3 bowel movements per week or passing stools that are hard, lumpy, dry, or difficult to pass out. That is, constipation is when you poo once, twice, or not at all in a week, or when your poo is hard, lumpy, dry, or difficult to pass. And this occurs when the colon, which is your large intestine, absorbs water from the waste, causing stools to harden. So what are the common causes and risk factors of constipation? Number one is dietary factors. This is when you don't take enough fibers found in vegetable, fruits, or whole grains, or when you take too much of food, or when you eat too much of food at once. And when you don't drink enough water, this can lead to constipation or can worsen constipation. And number two is sedentary lifestyle. This is when you don't move your body or you don't involve in exercise. This can cause constipation. Lack of physical activity can slow the digestive system, and this can lead to constipation. And number three is medications. Certain medications can cause constipation, or constipation could be a side effect of certain medications, like some antacid, iron supplements, or opioid painkillers like tramadol, codeine, and so on and so forth. The fourth one is ignoring the urge. This is when you have the urge to poo, but you ignore the urge. This can cause constipation or can worsen constipation. And the fifth one is underlying medical conditions. This is when you have already existing illness like irritable bowel syndrome, diabetes, or underactive typhoid. This can cause constipation or can worsen constipation. So what are the treatments for this constipation? Number one is changing your diet. The number one treatment is not to take drugs or buy drugs. The number one treatment is to change your diet. When you are experiencing constipation, the food you eat can make a big difference. Certain food can relieve constipation and others can worsen constipation. And the number one and the major food material that can relieve constipation is fiber. And this fiber can be divided into two types. Number one is insoluble fiber and the second one is soluble fiber. Insoluble fiber is what we know of as roughage. Our body cannot break down this insoluble fiber or roughage, so it leaves our body pretty much as it goes in. And this can be found in our popcorn or skins and seeds of fruits and vegetables like mangoes, apples. Insoluble fiber can also be found in our living grains, nuts, or dried fruits. Soluble fiber, on the other hand, is a food material that dissolves in water in the digestive tract. And when this soluble fiber dissolves in water in the digestive tract, it forms a gel which adds bulk to stool. And this gel also acts as natural stool softener, making bowel movement easier and more comfortable to pass. And this soluble fiber can be found in our whole grains, cooked vegetables, apples, bananas, and oatmeal. So some of the food I mentioned for constipation have both the insoluble and soluble fiber, like our apples and mangoes. They have the soluble fiber inside and insoluble fiber in the outer skin. So taking too much of this fiber can lead to gastrointestinal symptoms like gas, cramping and bloating, and this can worsen constipation. So it is better to take or to add this fiber in your diet so that your digestive system can adjust to the changes. It is better to eat in small quantity 6 times every day than eating in large quantity 3 times daily. So the foods you should eat if you want to poo instantly include prunes and prune juice. These are rich in naturally occurring sugar alcohol called sorbitol. The body cannot break down sorbitol, so when they reach the colon, the body wants to get rid of them, and this reaction can lead to bowel movement. The second one is apple juice. Apple juice also contains sorbitol, but in lower quantity. And people who do not like prunes and prune juice can take apple juice. This can help relieve constipation. And the third one is a hot beverage. Drinking hot beverages can relieve constipation, especially the caffeinated one or the one that contains caffeines like coffee and regular tea like green tea, black tea and white tea. They help to relieve constipation because the temperature of this hot beverage helps to speed up digestive motility, and the caffeine helps to stimulate the bowels, and this can help to relieve constipation. The second treatment is stay hydrated. Drinking 8 or 10 cups of water every day is better. Water is essential to helping fiber works its magics. And the third treatment is exercise. Exercising can help relieve constipation. Even if you don't want to exercise because you are constipated or bloated, moving your body can help move your bowels, and this can help relieve constipation. Like walking around, running or jumping, this can help relieve constipation. And the fourth one is over-the-counter medications or drugs. So when there is no changes or when you don't see any changes after this lifestyle adjustment, you can consult your local pharmacist or healthcare provider. Or when there is any complications like blood in your stool, severe pain or sudden weight loss, you can go see a doctor. So what are the foods you must not take when you are constipated? The foods you must not take are high fat foods. These are rich in oil, butter and grease, like fried foods, processed foods, baked goods or processed meats. These are rich in oils, butter and grease, and this can contribute to constipation because fat takes a long time for the body to break down and do not have or are low in fiber, and this can delay digestive motility and can contribute to constipation. So take care of your health. God loves you and I love you too. Bye.